Here at Duke, the mission of our Quality and Safety Fellowship in OBGYN is to train the next generation of quality researchers in women's health. We are at a pivotal time in women's health and maternal safety in the US and across the world, frankly. And our goal is to have new trainees who are comfortable caring for patients as well as developing quality interventions throughout the course of their careers. Our goal here at Duke is that we are a new program, one of the first, we believe, in the country to actually train specifically OBGYNs in quality and safety.
So I'm going to tell you about the education and the experience that fellows will need when they graduate from our fellowship. And we put these items into 3 different categories. So the development of knowledge, the engagement with the QI community, and then the development of leadership skills.
Our fellowship is designed such that 40% of the time is meant to be clinical. Depending on the person's interests and background, that may be as a general OBGYN, or it could be within their subspecialty. They spend about 2 days a week in clinical duties and are able to engage better with the entire team because they actually have the clinical experience in addition to developing their quality safety interventions.
We're very happy to be the first Quality and Safety Fellowship in OBGYN in the country. It is important that we train leaders in quality and safety in this specialty. There are other specialties who have had more involvement in quality and safety for many years, but really in our specialty there have not been any training programs specific to OBGYNs before ours, and we aim to train both specialists and subspecialists in OBGYN. So you can apply to the fellowship either as a generalist or as someone who has completed subspecialty training if desired. Our first fellow was a generalist OBGYN who came to us and went back to her training institution to become a vice chair for quality and safety at her institution. So we were very pleased to have someone who was so interested in quality and was ready to assume a leadership role when she finished. In addition to that, she performed a capstone project, which is something that every fellow does, where they work on a quality project that is near to their own practice. And she worked on this for a full year. She went to the front lines. She worked with staff in the obstetrics clinics. She worked with staff on the labor and delivery floor. She interfaced with the nurses, the medical students, the residents, the fellows, and really got to know the process that she was improving. And at the end of the year, she presented her project to both the Duke Quality and Safety Conference and our Hammond Research Day presentation, and she actually won both of those 2 presentations. So she won the first prize for fellow research at our research day with her quality improvement project.
In the fellowship program here at Duke, we have many leadership opportunities for our quality and safety fellows. They are given the opportunity, along with clinical champion as well as our quality manager, to lead task forces on quality and safety interventions across the department and the health system. They are able to mentor medical students and residents and develop long-term relationships with those trainees, as well as long-term programs that are able to be sustained long after they're gone.
So with regard to knowledge, we have several different ways to convey the knowledge that fellows need when they graduate from our fellowship. And these are didactic teaching, meaning taking classes and really having other folks teach you about the key ingredients to becoming a QI expert. There are core readings that are done, and we will direct you toward these texts and articles that allow you to really gain expertise in QI.
The research opportunities in this program are wonderful assets to the program and to the trainee who chooses to train with us here in the Quality and Safety program at Duke. Our hope is that all of the work that is done results in peer-reviewed manuscripts, and we actually are able to develop a research program for people who train with us so that they can not only develop new quality and safety programs in their future careers, but also have that accompanied by a research career in order to disseminate their findings across the nation and the world.